The horse racing business is a major contributor to the equine industry, with millions of people seeking entertainment and finance through witnessing the speed of beautiful thoroughbreds and their riders. While the business has many positive benefits, many argue that its harsh intensity and competitiveness jeopardizes the well-being of an American symbol of freedom, the horse. Excessive drugs administered on these athletic equines might have some temporary benefits, but studies show that this drug use acts as one of the most dangerous factors of the sport. Performance-enhancing drugs used in equine racing increases the risk for injury, death, and long-term illness, and its use should be reduced or eliminated to protect the well-being of young horses. Interest in horse racing has consistently been very high among United States culture. The industry reached its peak in 2012 with 8.37 million Americans acting as fans of the sport. In the past couple of years, however, the fan base has been slowly diminishing due to gained knowledge on the treatment of race equines and their injections of performance-altering drugs. The use of drugs in equine racing has had negative impacts on the popularity and welfare of the sport. According to the New York Times, money bet on horses at the track has decreased from $15 billion in 2007 to $11 billion in North America this past year due to the increasing public concern about the welfare of the horses and their riders. This is how the process works. Horse breeders sell their horses very young to prospective race trainers. Horses then begin intensive training and racing before their legs are fully developed, resulting in a lifetime of joint injuries. To account for these injuries, extensive drugs such as Lasix, phenylbutazone, ketoprofen, and flenoxin are administered on young equines rather than allowing for proper rest for healing, which eventually causes more injury at an extremely young age that will follow them through the rest of their career and lifetime. The presence of drugs interferes with accurate diagnosis by veterinarians to determine the health of the horse before it races. Excessive drugs can mask several types of injuries, such as lameness and respiratory problems, which leads to an injured horse being forced to race with disguised pain. The HFL Sports Science Laboratory is a lab that tests the pervasiveness of equine drugs in racing. According to Dr. Richard Sams, the director of the laboratory, a database that keeps track of new drugs and holds information of approximately 1,500 different types of drugs, shows that the popularity of performance-enhancing substances is becoming more prominent in the business. Let's look at how some of these drugs work. Phenylbutazone, also known as bute, is one of the most common drugs used in horse racing. It is an odorless white crystalline powder, and its molecular formula is C19H20N2O2, and it has a molar mass of 308.3743 grams per mole. Its melting point is at 105 degrees Celsius, and it is freely soluble in acetone, ether, and ethyl acetate. When decomposing, it releases nitrogen oxides. It is an acidic, lipophilic, nonsteroidal, anti-inflammatory drug that is very commonly metabolized in horses. The plasma half-life and the length of its cycle through the body is determined by the rate of hepatic metabolism in the horse, which are the chemical reactions that occur in the liver. Bute works by hindering the cyclooxygenase enzyme system, which is an enzyme responsible for the compositions of prostanoids. It then acts on the prostaglandin H and prostacyclin synthase to reduce swelling, sensitivity, and pain on inflamed soft tissues in the horse. Absorption of this drug into the gastrointestinal tract is then influenced by the dosage and its relation to the feed and the hay the horse is consuming, because feed intake can slow the achievement of peak concentration of the drug in the plasma proteins. The drug is easily detected in the plasma and urine of the horse, yet it is not highly concentrated in the saliva. On the pro side of this argument, drugs like bute significantly reduce lameness and inflammation in horses. Many argue that bute is a beneficiary in the race world because it treats several musculoskeletal disorders such as sprains, tendinitis, and acute joint injury. Similarly, it also controls fever associated with the symptoms of viral and bacterial infections. While the use of this drug might provide temporary relief, constant administration does create problematic consequences that are detrimental to the horse's well-being. As with any drug, proper dosage is critically important because if the dose is greater than the recommended amount, toxicity factors including anorexia, ulcers, depression, and death can occur in the horse. That's where the negative impacts come in. In the equine racing industry, drugs are especially important for horse owners and trainers who don't have the financial means to wait for injuries to heal naturally. Each day a horse is on rest, money is lost in the industry. Drugs such as buteflunexin and ketoprofen allow the equine to return to training faster, and many trainers misuse this value by overdosing and administering larger amounts of the drugs very close to race day. Horse owners and trainers are motivated by the purse structure of equine betting, where horses are made to run for more than their valued worth, resulting in trainers putting their horses on the track as frequently as possible, often to the detriment of the horse. To add on to that, when casinos are added to the racetracks, greed to race injured horses causes greater injuries at double the rate than the national average, because the people involved just want to make more money. I got to witness this greed firsthand when I went to visit the Tampa Bay Downs, a popular racetrack in Tampa, to learn about the industry.
Unfortunately, we still have owners and trainers that they are in this business just for money and not for love.
Owners use this allowance of drugs to push their horses to run at significant speeds until their bodies will no longer hold up. According to NPR's Eleanor Beardsley, 95% of racehorses in the United States are medicated for problems that only affect approximately 5%. Racing trainers here experiment with many types of illegal substances to enhance the performance of their horses, such as cancer drugs and even cobra venom. Another extremely controversial drug is Lasix. According to Dr. Erica Wireman, an equine veterinarian, furosemide, better known as Lasix, is another common drug used in equine racing. It is a diuretic medication that reduces total body fluid, resulting in a decrease in pulmonary hypertension in the lungs. Lasix makes the horse urinate excessively, which can cause a loss of up to 30 pounds in body weight from loss of fluid, resulting in extreme dehydration, which requires more drugs for recovery. This reduces bleeding in horses with exercise-induced pulmonary hemorrhage, EIPH. Horses with EIPH are often known as bleeders because internal bleeding occurs in their bodies and blood comes through their nose after running. This happens because a rupture occurs in the small blood vessels in the lungs of the horse, and then the blood leaks into the air spaces in the lungs. This occurs from increased blood pressure from excessive exercise, limiting the horse's ability to oxygenate, creating poor athletic results in the races. Lasix, however, limits the bleeding in race horses, allowing for excessive intense exercise to continue. Lasix has a molecular formula of C12H11Cln2O5S and a molar mass of 330.74414 grams per mole. It is an odorless, slightly yellow crystalline powder with a melting point of 206 degrees Celsius. When heated, it decomposes into hydrogen chloride, nitrogen oxides, and sulfur oxides. Corticosteroids also act as immunosuppressants that inhibit certain factors of the immune system, which increases susceptibility of the horse to certain cancers and infectious diseases. The use of these drugs results in long-term illness and injuries such as weakness, loss of muscle mass, induced diabetes, and stomach and duodenal ulcers. The New York Times released that the racing industry adds an economic benefit of $25 billion each year to the U.S. economy, as well as creates more than 383,000 job opportunities for Americans each year. The star of this industry is the horse, and this animal deserves protection for all of its hard work and dedication. Despite the value of this animal in American culture and as a racing necessity, the habit of using extensive drugs in equine racing in North America continues to put extreme risks on the well-being of the horse and its rider. According to a New York Times investigation in 2012, 24 horses die each week at United States racetracks, an extremely higher rate of death compared to other countries where drug use is restricted. However, things are starting to look up. Backed by horse owners and animal welfare groups, Congress has recently introduced the Thoroughbred Horse Racing Integrity Act of 2015, which would allow for the creation of stricter rules concerning testing and medication in thoroughbred racing. Under this legislation, the USDA's Thoroughbred Horse Racing Anti-Doping Authority will manage an anti-doping program for horses at the beginning of 2017, which will better regulate the use of the drugs in the sport. Drugs used in the sport of equine racing are being constantly abused, and the use of these drugs must be regulated to protect the health of American racehorses.